Hello, everyone. I am Urusha Maharzan, and I would like to welcome you all on behalf of Women in Global Health Norway. Women in Global Health Norway is, amongst other things, engaging its members through a task force on COVID 50/50 that I'm honored to be part of. The task force COVID 50/50 is engaged in bringing out the stories of women working and contributing to the health sector during the COVID-19 pandemic in Norway. We are talking to women from a variety of health related workplaces, and today we will dive deeper with our guests to gain a better perspective and insights on the effects of COVID 19 to the national healthcare system. With that being said, I would like to kindly welcome and introduce Marianne Jahre, Professor of Logistics at the Norwegian Business School and Lund University. Marianne, you have been working with disaster relief logistic research and teaching for many years, heading projects and supervising students with several international agencies, amongst others UNICEF, Norwegian Red Cross, and the Norwegian Refugee Council. You head a mobility project in cooperation with Jimma University in Ethiopia, a research project on drug shortage, as well as a research project on COVID-19 response, together with the Norwegian Institute of Public Health and two health research institutes in Ethiopia. We are so happy that you are here to share your experience and insights with us today. Welcome. Marianne, I would like to begin with your background. So tell us a bit about your personal history that led you to the current work.
Thank you, Risha. So nice to see you. So I've been teaching and doing research in logistics, operations, and supply chain management for more than 30 years. But I've always been more interested in how my field can contribute to society rather than to profit of businesses. So that's why I finished my PhD on recycling and environmental logistics in 1995. Since 2007, I've been working mostly with disaster relief logistics, humanitarian logistics, and supply chain risk management, what I call the most important logistics. So it was a project about 10 years ago when I worked on drug shortages in Uganda for UNICEF that created my interest in health supply chains and logistics, particularly in low income countries. You mentioned the MIA project. The MIA project is on drug shortage in cooperation with the Norwegian Institute of Public Health and 3 European universities. We call this project MIA, and the idea here was to simulate a big epidemic to study effects and interventions by using our models. And then we were outpaced by the pandemic, by the virus. Hence, we set up the COVID-19 project with the Norwegian Public Health Institute and 2 health universities in Ethiopia. So in essence, this project combines all my interests. It combines disaster relief, risk management, and humanitarian logistics within health supply chains. Thank you.
So, Marianne, can you tell us what are the challenges for pharmaceutical and medical supply chains in Norway due to the pandemic?
I think it's very important to know that pharmaceutical supply chains have had challenges long before this pandemic. Across the globe, including in Norway, we have seen an increasing number of medicine and vaccine shortages. And the reason for that is that these supply chains are complex, they are global, reaching across many, many countries. We have, or the sector has tried to reduce the costs and thus the prices of medicines, with resulting low safety stocks and then also little preparedness. This development has led to the challenge that such supply chains then have become very vulnerable to disruptions. And this also goes for Norway. Hence, when the pandemic struck, our stocks of personal protective equipment were low, and there was a lot of fear of not having enough medicines. However, our research so far, and we've done analysis of public reports and we've done some interviews with key stakeholders in Norway, shows that Norway quickly mobilized, established close cooperation between the stakeholders, adapted procurement process to secure stocks of COVID-related medicines and equipment, as well as other medicines in case the supply system would break down. And it could break down because of spiking demand, and or supply disruptions. For example, the China and India would set restrictions on export of raw material and medicines, or that we would see lack of transport, closed borders, and so on, which would delay the supply chain. So in Norway, lots of extra funding was provided that enabled us to set up the system quickly. Not all countries are that lucky. Not all countries have such a good cooperation between the actors and a clear leadership as we've seen in Norwegian Institute of Public Health and our own government. So what is important to understand is that our project requires not only competence in supply chain and logistics, but also a good understanding of the medical aspects. So the Public Health Institute's role in our project is their competence in medicine categories in general, antibiotics and vaccines in particular. And so is their involvement in various European and international networks related to medicines. They also have a lot of knowledge on existing databases we will use, as well as modeling approaches. Our Ethiopian partners are medical doctors and pharmacists and provide such competence as well as the necessary context knowledge. Hence, this is a truly multidisciplinary approach.
In your opinion, what additional strategies might be helpful to combat the challenges of COVID-19 in your work sector?
I'm speaking strictly on how to improve the medicine and vaccine supply chains going forward, which is how I define my work sector in relation to COVID. There is a lot of good work ongoing, and many projects have been established in Norway and elsewhere, including the EU. What I'm worried about is that due to the emergency, there will be too much focused on short-term solutions. For example, establishing preparedness stocks of many drugs in big volumes in many countries, rather than making evidence-based decisions on what interventions to implement for more long-term solutions. If we look at research within supply chain risk management and logistics preparedness, it gives a lot of insight to various types of interventions we can do to improve our supply chains. Our field gives a basis for developing decision support tools and do analysis of cost effectiveness and comparing the different solutions.
In your opinion, are the responses and strategies of Norway different from other countries? And if so, can you tell us how?
Mm, I will try. Well, our project just started. So we are in the process now of developing the studies as we speak. Hence, I can only provide some initial impressions from what I've seen so far. Norway has a very centralized system for procurement and supply chain management of medicines. And this seems to have helped a lot during the pandemic. People know each other, they cooperate. Additionally, our Directorate of Health had just published an extensive report evaluation on how to improve preparedness, which helped a lot. Norway is a small market. It's highly structured. We have 3 big wholesalers with their own retail pharmacy outlets. We have Sykehuspartner procuring on behalf of the hospitals. To compare with a bit with other countries, we see that Sweden has a much more regionalized system, which makes it hard to have a good overview and agree on actions. Similarly, in Belgium, they have 9 health ministers, one for each region. And in Italy, they have 20,000 independent pharmacies. We are now setting up a supply chain study in 6 European countries in addition to Ethiopia to try to make a comparison, and it will be interesting to see what we find.
What lessons, professional or personal, have you learned from and during the COVID-19 pandemic?
Well, obviously, as anyone, we have learned a lot. But I want to focus on 2 things in particular. And I think one is to say that in crisis, leadership is essential. While you as a leader might be uncertain because you don't know everything, you don't have all the data, I think you should not transfer all this uncertainty to the ones you lead. Sure, you can say that we do not know for sure, but you must show the way. I think the Norwegian government and the Norwegian Public Health Institute have been excellent examples here. Personally, as a research leader, I have experienced that digital interaction through Zoom, through mail, can be extremely efficient and helpful. However, since March, I've been setting up a new research group with 30 researchers of different disciplines, different languages, and different cultures. People where very few knew each other from before. this has been very challenging because we've not had the possibility for meeting face to face, allowing for long and deep discussions over a couple of days, like we researchers normally like to start our projects. The informal part of interaction somewhat disappears and make it hard to get to know and to trust each other. So I think those have been, that's been a very key challenge. And I think a lot of people experience that there's one thing to work together when you know each other from before, but to accept new people onto teams and get to know each other over Zoom, that can be very challenging.
Marianne, I'd like to wrap up this interview by moving on to the last question.
Mhm.
That is, what lessons have you learned in your career path that you might like to share with all, especially women?
Well, I can only speak for a career as a researcher, since this is basically what I've been doing all these years. I could, of course, say a lot about this, but I will try to be short. I think for me, there are four key points I like to point at. The first of all is that you have to be engaged. You have to like what you do. That's at least what has been driving me all the way. So engagement is a key thing here. My second point is that cooperation with others is really important. But it's also really important to find out who you cooperate well with. My experience shows me that it's important to make sure to work with people who are givers, not only takers. There is a lot of energy that materialize in cooperation, but some relations, working relations and others, can be totally energy draining. My third thing is that I normally say what I mean, and I try to do what I say. And I think this is something at least that drives me, and it drives my engagement, and it drives me to work hard. And my final point, I think, would be, well, so I'm a professor, right? I don't want to look like a professor. I want to surprise colleagues. I want to surprise students. I want to surprise my family. I want to surprise my friends. So I think we should be not be afraid of surprising others. Don't go into a role as a professor or as a medical doctor or as a nurse or whatever. So I think to me, contrasts are essential, both in life, in nature, but also in people. So I would close it off by saying that don't always do what people expect.
Thank you very much, Marianne, for joining us and taking the time to share your experience and knowledge in such an informative and inspirational manner. We look forward to seeing more of your work and good luck with all of your future endeavors.
Same to you, Rusha.